Hey everybody, it's Katie. Today I wanted to share a little bit of my experience requesting a free breast pump through my insurance. I've done a little bit more research and investigation about this process, and just in the time frame that I've been looking into it, I know 2 other moms out there on Facebook have been able to get breast pumps through their insurance as well. So I just wanted to share some of the information and my experience. I can't guarantee that your benefits will be exactly the same, but it's worth at least finding out. If you have private insurance, it's worth at least making a call. That's your one takeaway from this, even if you don't watch the whole video. If you have private insurance, just call them and ask what your benefits are if this is something you'd be interested in. I remember maybe a year ago hearing something about insurance possibly covering a breast pump, and really this is my second baby that I'm expecting any day now. With my first, I only used really a manual pump. I only went back to work part-time, so I didn't feel the need to pump very much. So it really wasn't something I was going to follow up on. But then the more I thought about it, every baby's different. I really can't predict what'll happen, if this baby will have some kind of feeding issues or just, what our situation will be. So I feel like I might as well, we're paying all this money every month to have insurance coverage, I might as well get my full benefit. And in my experience, it really was worth it because I got a great pump delivered totally free to my door, absolutely no out-of-pocket. It was covered 100% under my plan. We don't have a super fancy plan. We have a pretty high deductible, we have pretty high copays, but in this case, the coverage was really good. So all this is possible because of a provision of the Affordable Care Act, or Obamacare. It's something that's just been in place for about a year or so now, and it really only applies to plans, healthcare plans that you start, you sign your contract after, I think it's August 1st of last year, August 1st of 2012. With our plan, it is something we have to renew every year, even though it's the same exact coverage. We just have to sign a new contract every year. So, this being 2013, this was in effect for us. If you have an older plan that you don't have to renew, you can be grandfathered out of this benefit. But basically, so the Affordable Care Act says that insurance companies are required to provide breastfeeding support and provide coverage for pumps and accessories and even visits with a lactation consultant. Again, that's not something I've really researched a lot because where I live, I have access to free lactation consultant advice. But man, what a great benefit for moms who need it. So of course, insurance companies are going to be looking for loopholes in this law and looking for ways to keep their costs down. So depending on the company and the type of plan you have, there might be different restrictions on various things. Just in a little bit of investigating that I did, there may be a specific time frame in which you have to order your pump. You have to be a certain number of months pregnant, or your baby has to be under a certain age. They definitely restrict what models you can get. You can't probably just get any pump. There are certain ones that they tell you that you would be eligible for. I have heard that some plans require a doctor's prescription to say that this is something necessary for feeding your baby. And also, there are different benefits for babies who are in the NICU. I've seen some discussion of Medicaid covering pumps as well, but since Medicaid varies by state, I imagine the benefits are probably, different state by state too. So the process I used when I decided this was something I wanted to pursue was, first of all, I just called my insurance company. I called the number on the back of the card and just asked the question, do you cover, breast pumps, and at what amount? I have Aetna. Under my plan, they would cover 100% with no copay of certain models of breast pump ordered through durable medical equipment providers that they contract with. So basically certain companies that they have a relationship with, if I order from them, then it'll be covered. So they referred me to a website that listed, I think there were 6 companies to choose from that sell breast pumps. From there, I looked at the options available. Every company offered different models of pump. I have heard that some people kind of get the runaround when they call their insurance and ask those questions and they can't get a clear answer. And a tip would be to just request your benefits in writing. I think that they're required under the law to provide you something, on their website or by email or by snail mail, detailing exactly what their coverage is and how to go about that. So anyway, I found that one of the companies that Aetna contracts with would provide me a Hygieia Enjoy pump. Pretty standard looking, all the parts. I haven't cleaned them yet. But the reason I picked this one is because it's a hospital grade dual electric pump that is a completely closed system. So a lot of breast pumps are really just made to be used by one person, and they have, parts inside the pump itself that really can't be cleaned or replaced. The design of this one, though, does allow for totally safe use of multiple users. So I figure when I'm done with it, I can sell it or donate it to somebody else. Besides the pump itself and the accessories, this came with a year membership to La Leche League, which really just gets you like a 10% discount on the stuff on their website. And there is a bag to put it in that is an insulator bag. Alright, so after I placed my insurance order on that particular website for this pump, the next business day, that company contacted me to just let me know that they had contacted Aetna, verified all of my coverage, and told me everything was good to go. And then the pump arrived on my doorstep, I believe, 2 days later. So it was a total of about 3 days turnaround from the beginning of the process to the end of the process for me. Of course, I haven't used this particular pump yet, but I've only heard good things about it, and really just overall, I couldn't believe how fast and easy and painless the whole process was. Like I said before, I can't guarantee you'll have the exact same experience, but it's worth a shot. If you don't qualify for a pump through your insurance for whatever reason, or if you've already bought one out of pocket, some things just to keep in mind: that is a deductible medical expense for taxes, for your income taxes, but I think it's really only going to work out for you, if you spend $200, $300 on a pump. To be able to deduct medical expenses, it still has to be like 7.5% of your annual income. So you're probably going to have to be in a situation where you have a lot of other medical expenses, and this is just something you add to that. The year Alice was born, she was in the NICU for a week, and we had a lot of out-of-pocket medical expenses. We paid thousands of dollars, but still at the end of the year when we filed our taxes, we were just barely under that 7.5%, so we didn't get any extra deduction. One other possibility, if you have the option of a flex spending account or a health savings account, FSA or HSA, through your work, that is money from your paycheck that is put aside pre-tax, and then it's used for healthcare expenses. Breast pumps are an eligible expense under those type of plans. So that's all I know. Hopefully this information will help somebody out there.